The third part of whole person care is focusing on what creates health. When I was in medical school, probably same with you, I studied from the textbook of pathology and I studied pathogenesis, the creation of disease. And there's a flip side of that that's going on all the time in us that we wouldn't be around, and that's salutogenesis, okay? That is the creation of health. We have this inherent healing capacity, but usually what we do is say, here, you've had your surgery, go home, get better. When what we could do is that we could say, hey, here's some ways to facilitate that getting better and facilitate healing.
Hello, and welcome to Pursuing Health. I'm Dr. Julie Fouché, family physician and former CrossFit Games athlete. Here, I bring you information and inspiration to help bridge the gap between fitness and medicine and support your journey toward your healthiest self. Thank you so much for joining me. Now let's get started with this week's episode. Welcome back to Pursuing Health. I am very excited to be here today with a repeat guest on the podcast, Dr. Wayne Jonas. For those of you who don't know Dr. Jonas, he is a widely published investigator. He's a practicing family physician. He's a professor of medicine at Georgetown University and at Uniformed Services University of Health Sciences. He's also a retired lieutenant colonel in the Medical Corps of the United States Army. As a little more background on his medical career, he was the director of the Office of Alternative Medicine at the National Institutes of Health from 1995 to 1999. He led the World Health Organization's Collaborative Center for Traditional Medicine. And prior to that, he served as the director medical research fellowship at the Walter Reed Army Institute of Research. Now he advises national and international organizations on ways to implement evidence-based healing practices in their medical systems and serves as the president of the Healing Works Foundation. So we first caught up in episode 116, which was several years ago on the podcast. We met after a family medicine conference and we discussed his earlier book, How Healing Works, which played a key role in opening my mind to understanding health in a more holistic way. And we actually re-released that episode just recently. So if you haven't caught it, I recommend going back to listen. And his newest book is out now called Healing in Cancer, A Guide to Whole Person Care, which he co-authored with Dr. Alyssa McManaman. And it was released just last month. So I'm excited to catch up and talk more about healing and cancer with you, Dr. Jonas. Welcome back to the podcast.
Thank you very much, Julie, and feel free to call me Wayne. And I hope you do catch up with Dr. McManaman, the co-author of Healing in Cancer. She, in many ways, is the heart of the book, and I think you could also have a great conversation with her about that book, but I'll do my best.
That's a great idea. Well, I thought we could start with a little background for people who maybe haven't heard our first conversation or haven't heard it in a while. You have really focused your career in medicine around what you call whole person care. And I'd love to understand, I was having a conversation with someone about this recently, as I've taken a little unconventional path in medicine myself, and that there are certain experiences we have in life that set us up to be open to taking a different path, to going a little bit against the grain, asking questions, being curious, and not just settling for the status quo. And so I'd love to understand for you, or to recap, what led you to pursue this broader context of healing that you call whole person care?
Yeah. Well, I think there were two main things, Julie. Thank you for that question. One of them was in sort of my formative years in life, when I was thinking about, what did I want to be when I grow up, in middle school and high school. My father was a chaplain in the military, but he was a hospital chaplain. So he went into the hospital every day as a chaplain. And when I got old enough, I said, well, what do you do there? And he says, I help people heal. And that confused me a little bit, because I thought, I thought that's what the doctors did. Didn't you go into there? And well, he said, there's a different part of a person that I help heal. And I said, gee, there's a part of the person that doctors don't deal with, the mind and the soul. And he said, well, yeah, not as good as chaplains do, and we're trained to do. So I got very curious about that. and said, well, how can healing actually occur without that component? And so before I went to medical school, I actually went and did some clinical pastoral education as a student chaplain myself. Right before I went to medical school, I knew I was going to go to medical school, but I wanted to see what it was really like. And so I spent about 6 months at a Union Theological Seminary pastoral education training program, acting as a student chaplain in the hospital. And I took that with me as I went into medical school. And it made me realize that no matter what disease we're dealing with, what part of the body we're dealing with, everybody's got a mind and a soul. And so if we neglect that part, we're going to miss out on some of the most important parts of healing that are available. So you have to make sure you pay attention to those. So that's one element. The second thing was I spent the first 20 years of my career in the military. And in the military, it wasn't just about treating diseases. We actually had to keep people healthy. They had to be performing and the ability to perform at the drop of the hat to go defend the country. And so we focused a lot on health promotion and performance optimization as part of the medical corps. And I had resources to do that. I made it a standard part of my practice, incorporated into what I did every day. I thought, gee, this is just good medicine, right? You treat it and they get sick and you keep them healthy otherwise, and that type of thing. When I got out and I got out into the civilian sector, I was at first shocked and then saddened by the disintegration, if you will, and the partial treatment of individuals, the lack of holistic care, the lack of focus on what I call salutogenesis, or the creation of healing, and just a focus on pathogenesis, what happens in the disease components of it. And realize that the failure to actually proactively facilitate health and healing and prevention, it was at the core of our underlying national healthcare problems. The rise in costs, the lowered health that's going on in our country, the lowered life expectancy that's going on in our country that has been accelerated, was accelerated by COVID, but was going on before that in those areas. The treadmill that people are on, and the burnout, dissatisfaction, and increasingly the disparities, because the costs go up and there's a greater gap between the haves and the have-nots in terms of just basic medical care, much less actually health promotion. So we need to go upstream. We need to pay attention to the person. We need to focus on health creation, salutogenesis, the generation of health, or we're going to continue to get into more and more problems in healthcare. So that's sort of what led me, to try to move into whole person care.
That is fascinating, and I hadn't thought about it that way from your story, but I think my path is similar in that I came into medicine as an athlete, where we were looking for how do we optimize our performance, similar to how you were working with individuals in the military. And as part of that, we're looking at what are we eating, how are we sleeping, what kind of visualization are we doing. There's so many other tools that you don't always get exposure to in the conventional healthcare system, where the focus isn't on how can you be the best at whatever it is that your personal mission is in life, when a lot of those tools are very accessible. And shouldn't we be helping every person reach their full potential, right? Not just waiting until they get sick and waiting to put Band-Aids on that problem.
Yeah, no, that's right. I would say when I was at NIH and ran the WHO Center, and we began to look at non-Western conventional practices from around the world, many of which are thousands of years old. In those areas, I realized there was a much bigger medical bag than I ever had and learned in medical school. And some of them were very useful. A lot of them didn't have science, but my job at NIH was to begin the process of investing in the research to understand them. And now I would have to say that, we're really filling in that science, not only in behavior and lifestyle components, as you mentioned, in those areas, but even some of the complementary complementary and alternative, what were known as the unconventional practices that came out of things like Chinese medicine, Ayurvedic medicine, herbal medicine, et cetera, now are increasingly have good evidence and are getting into guidelines for delivery in this care, and so can be brought into routine care in the West. And that's part of doing whole person care also.
I love that. As a little caveat, I'm curious, what is maybe one or two of those unconventional practices or alternative practices that actually have good evidence behind them now, that people should
Yeah, I'll focus on the ones in cancer because of the recent book that came out on healing in cancer. There are now 3 guidelines that have come out from the major cancer organizations, the American Society of Clinical Oncology, ASCO, and the Society of Integrative Oncology, which is the integrative membership group on that. And they have clearly shown that in the area of pain management, for example, acupuncture has value. Both for treating the side effects of pain from treatment, as well as the general pain that occurs along with cancer or postoperatively and that type of thing. The other area, as an example, is mind-body practices. Mindfulness, meditation, stress management, biofeedback. There's a variety of them, hypnosis even. Have significant effects on depression and anxiety, can even impact fatigue, for example, and improve fatigue. Activity, exercise, huge impact on the quality of life and the length of life in people with cancer. If it was a drug, it'd be patented and FDA approved.
That's right. Areas. Everybody be on it.
There's excellent evidence now for that, and it's in the guidelines. And so the question is, how do you get these things into routine practice so that it's not just about hitting the tumor over the head, but changing the environment in which the tumor exists, which we now know from the basic science actually is influential. Tumors don't just pop up in isolation. They pop up within the tumor microenvironment, which is part of the macro environment, which is influenced by things like diet and stress and social support and that type of thing. So I think those are the areas that really are drivers and motivators in these areas around cancer, for sure. But the ironic thing is that many of these same behaviors are also the same factors that mitigate and prevent the risks for or even reverse some of the major chronic diseases that we have outside of cancer. Heart disease is the one that's known most prominently in medicine, but the same things that influence our basic inflammation in our body, our immune system within our body, the metabolism within our body, those same core wellness factors mitigate many of the major chronic diseases like obesity, diabetes, hypertension, et cetera, that are the day-to-day things that we treat in primary care too.
Let's back up for a second and let you define whole person care for us. So I know that you've described a little bit about looking at the whole person, but how do you define whole person care as a whole? And then we'll dive back into cancer.
Yeah, so I've got a very specific definition of whole person care. And unfortunately, these terms that you hear about, whole person care, whole health, lifestyle medicine, integrative health, et cetera, they often get interchanged and used interchangeably as if they were all the same thing. And I do not think they are. I wrote an article in the Journal of Family Practice a couple years ago defining the different components of advanced whole person primary care and showed where those other kinds of practices fit into that in those areas. So, you can put those in the notes if you want to refer some of our listeners to that.
Absolutely.
But basically, what we mean by whole person care are 3 things. Okay. Number 1 is that you find out what's important to the person. You help set goals with the patient as to what they want out of their health care. And the best thing is to start with, why do they even get up in the morning? What's important? Why do they want to have health? What helps them live? What brings them joy? And so in the tools we use to do whole person care, that's the number 1 question that we start with. Who are you? What's meaningful for you? Why do you get up? What matters in those areas? And then we begin to align, the health behaviors and the health components as part of that. The second aspect is that you need to actually know what the whole person is and see the whole person. Okay. Now, that fundamentally involves four areas. One, the physical environment in their body. Yes, we do pretty good on that for the most part. The behavior is a key part of who they are. And we, know the science says that's important. Okay. Diet, stress, activity, sleep, etc. So we ask about those parts, and that's where they have to get engaged in the creation of their whole health. But then there's two other dimensions that we often neglect in those areas. One is the social and emotional part of a person. Okay. And the second one is the meaning and purpose, the what I call the mental and the spiritual part. And so you have to be able to ask people about that. You don't have to have mental health to need to have a healthy social and emotional body. You still
Right.
have one, right? Even if you've got a physical disease, and appropriate delivery of health care would make sure that you ask questions about that. And so, in the tools that we use, that's the area. The third part of whole person care is focusing on what creates health. When I was in medical school, probably same with you, I studied from the textbook of pathology, and I studied pathogenesis, the creation of disease. And there's a flip side of that that's going on all the time in us that we wouldn't be around, and that's salutogenesis. Okay, that is the creation of health. We have this inherent healing capacity, but usually what we do is say, "Here, you've had your surgery, go home, get better." When what we could do is that we could say, hey, here's some ways to facilitate that getting better and facilitate healing and salutogenesis. So this needs to be on equal grounds, at least the salutogenic part and the pathogenic part. Yes, treat the disease when it emerges, but even more than that, address and support the underlying healing capacity, the salutogenic factors. Those are the three components of what I consider whole person care.
Amazing. And I know you've focused on this model in primary care for many years. And as I was leaving residency a few years ago, you were selecting different sites to gather data and implement this model. And since then, you decided to focus on whole person care in cancer. And that, led to this book. But what led to that decision to say cancer is the next place we need to take this model?
Yeah. Well, primary care folks, they sort of got it. They said, like, I see this happening. It's important. In family medicine, where I was trained, we had the biopsychosocial approach, which was considered a core part of it, a very holistic, if not now a bit outdated framework for that area. And we began to bring these tools into primary care, and they got good uptake. They got brought into the definition of high quality primary care that the National Academy of Medicine wrote their report about several years ago. It's being put into policy. It's sort of the horses left the barn. They're out of the box in primary care, and now they're looking at how to do this. So we looked around and we said, well, what's the most important gap and need in those areas? And we did a couple surveys in the cancer care. We thought it was in cancer for a variety of reasons that we can talk about, but we did some surveys both of oncologists as well as patients who had had cancer. And we found that the people with cancer wanted this type of care. They were asking for it, they were looking for it, and they wanted it early on, right from the beginning, not just later on. And the oncologist said, yeah, we think it's important, but we'll do it later if they need it in those areas. So there was a gap there. The oncologist began to know about the science that I just described, the tumor microenvironment, the fact that lifestyle and behavior influences cancer progression. There was an emergence of new types of therapies, and there's continues to go gangbusters in that area. Immuno-oncology, the influence of the immune system now with new drugs, targeted oncology in those areas that are influenced by things like the microbiome, for example, which are influenced by diet in those areas. And so there was a gap both of knowledge and demand. And as you would expect, there was a communication gap. And so we said, well, cancer is a key area that we need to try to create an initiative to assist healthcare teams to deliver whole person care and close this particular gap. And so that's why we decided to put together an initiative, partnered with the oncologist, Dr. Alyssa McManaman, who helped write the book, and then create CME and other kinds of tools to begin to allow oncology teams and patients who wanted that type of care to move that kind of care forward into to their cancer care.
Absolutely. There was a great quote from the book where you said cancer diagnosis is a challenge to all of these needs simultaneously, making them crystal clear. And that really struck me because it does seem like cancer is such a accelerated and focused experience with the healthcare system, a facing of mortality that doesn't always happen over such a concentrated period of time with other chronic diseases. So, can you elaborate a little bit more on that?
You're exactly right. I think more than any other chronic disease, cancer focuses you on what's important in life because of the fear and sort of the idea that when you get a cancer diagnosis, that somehow is equivalent to death. You know, you think you're going to die soon, and so it creates fear. Well, the biggest killer in the world is hypertension. It's invisible. Okay. So we're not running around being fearful
Afraid
of
of
that,
that.
right?
Yeah.
Even if you get a heart attack and heart disease, it's like, okay, now you can get into rehab and all that stuff, and so it doesn't really hit you in the same way as a cancer diagnosis, in which suddenly it wakes you up and say, oh my God, I got to get rid of this or I'm going to die. And yet it is a chronic disease, and with the increasing kinds of success and treatments that we're getting around it, it's getting turned more and more into a chronic disease. Some of these treatments are allowing people to live for a long period of time. And so guess what? The person's still there. The quality of their life is important. And the ability to live long and to live it well requires that we pay attention to the person. So there's a great need, and cancer focuses on let's pay attention to those factors and bring that in, which is why I think it gets right to the soul, right? If you're faced with death and you think it's going to be soon, it's like, okay, now I will ask myself what matters today
Right.
or in this next moment. And so it makes that conversation even more important than
Absolutely.
it does with other chronic diseases. Not that it isn't important in other chronic diseases. If you have advanced heart failure, you may not have very long to live. You ought to have a conversation about how do you make the best of those times. Same with COPD and others, but they don't focus it. It doesn't focus it as quite as much as around cancer. So it's a salient and a rich place to have that conversation and those deep conversations about the relationships that develop the relationships that create sort of important bonding and trust can occur around cancer in a more rapid way than they seem to do in many, many other conditions.
Absolutely. Is there a particular moment from your own practice that solidified your belief in the importance of whole person care in oncology?
I don't know if there's a particular moment. I mean, I saw it happening. I had some personal experiences in my family with cancer early on. My wife got breast cancer when she was 34. She's now in her 60s. So that kind of woke us up around that. But I would say the thing that when I reflect back that illustrates the importance of whole person care was a patient I had a number of years ago that had chronic myelogenous leukemia. I actually had two at the same time with CML. And as you know, these tend to indulate along, but then they might flare up into acute lymphoblastic problem, which is very deadly, okay? And it kills individuals. This individual had undergone a bone marrow transplant. They'd done pretty well, but they said, I'm never going to do that again. And their white count began to go up, and they said, I'm not going to do it. And they went on a macrobiotic diet, and their oncologist said, you're crazy, da 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 da. I'm not going to, work with you anymore. And so they found me somehow, okay, and said, would you help me with this area? And so, I said, I'm not going to abandon you on this area, but I'm not necessarily going to agree with everything that you're doing.
Sure.
So we supported them, and actually on their macrobiotic diet, they seemed to do pretty good. They were able to actually control their white count on their own fairly well followed it along. I kept encouraging them to go back and find an oncologist that would work with them and listen to them. They did eventually. So we got them linked up with that, and we began to work together in a truly whole person integrated fashion. Uh, then they discovered the importance of the Philadelphia chromosome there, and that there were certain tyrosine kinase inhibitors, new types of treatments that could target that and was really benefiting. And we were able to talk the person into getting that and starting that in those areas. And so she did them both together, and she did very, very well for over a decade in those areas, probably 15 years. Eventually, she went into a blast and then was put on life support. And her family asked me to come when they took the tube out and let her die in those areas, because they wanted me there because of the journey that we had had together around whole person care. And I realized then that that kind of integrated model was the best model that we could do to provide her the best of care and provide me with the most rewarding relationship that I had with her. So I'd say that in cancer is one of the seminal events. I had another patient that abandoned all conventional care. And, she actually progressed and suffered quite a bit. And despite my attempt to try to get her into getting into palliative care and that kind of thing, she didn't want to do it. And I also was at her bedside when she died. And, it was a very sad situation in those areas. So again, re-emphasizing the importance of integrative care.
Those are beautiful stories. And it's cool to think about, you as a pre-med student going to do an internship as a hospital chaplain, and then later on, bringing this full circle and caring for people's spirits in such a way that they, want you to be there when they die, which is really.
Well, I'm hoping that the second patient I mentioned to you about at least provided some comfort from my actually physical presence, holding her hand despite her rejection of even hospice care,
Sure.
unfortunately. So.
Sure.
Mhm.
Well, going back to thinking about cancer as a whole, you mentioned this a few times that it's not just a single disease, but it's happening in this ecological network of our whole environment as a whole person. And so often the medical treatments are drugs that are focused on one specific aspect of that, one target, which doesn't allow us to address the whole person. So can you explain more about how, this understanding of cancer, and then how we can help to address all the other components that those drugs aren't targeting?
Yeah. Well, with the knowledge of the biology of cancer, and often they're summarized as the hallmarks of cancer, the underlying biology of cancer. We realize that there are individual and multiple things that drive cancers, even in the same person. Cancers in different places behave differently.
Right.
And so there is a growing realization that we need to figure out how to do synergistic treatments. And this is even just with drugs. There's growing efforts now to figure out what are the best combinations that hit at different drivers in cancer to do that. So this idea of using a more of a holistic drug approach is emerging. Immunotherapy, along with targeted therapy, along with chemotherapy, radiation surgery, et cetera, combined, is now emerging. And there's a lot of research going on in that, but it's sort of, a lot of it's not completely out of the box yet and FDA approved. It's a little hard to do that because we do tend to approve single target, as you mentioned, and and the economic drivers behind the drugs is, isolating the single target with a patent and an FDA approval, et cetera. So we need to shift that framework. But in the meantime, there are some things that are not harmful if they're delivered right, and I'll say they've got to be delivered right. That facilitate the quality of life and even the length of life in those areas. Many of those come out of those wellness practices that we talked about. We know that sleep is a key issue. Majority of cancer patients have disrupted sleep. We know sleep disrupts a lot of physiological processes, including the immune system. So ask about sleep. Try to address sleep. And there are multiple drug and non-drug approaches, mostly non-drug approaches, that can facilitate sleep in those areas. We know that that activity is a huge exercise is a huge aspect. 30 minutes of exercise a day drops your risk of of cancer, of recurrence even, by close to 30%. Okay, that's a big effect.
Yeah.
Social support, often neglected in those that just deliver lifestyle therapy, right? Very, very important. And there's good research now showing that those that have high social support over the next 5 years have a 25% chance of living longer than those surviving that 5 years than those that have low social support. Okay, so ask about social support. Look at facilitating and bringing in the social and emotional components of those areas. So these are things that should be discussed and bring tools in and talk to patients about those areas. Now, at the same time, we have to be careful how we do that because they aren't necessarily the cause of cancer. I've had a lot of patients that have come in, and unfortunately, it's many young women or middle-aged women that come in and have been diagnosed with breast cancer, and they said, "What did I do wrong? Okay, I'm a vegetarian. I exercise and do yoga. I have lots of friends and family. I must have done something wrong to get this." Well, you know what? They didn't do anything wrong. And they got to stop blaming themselves and feeling like, well, I got to do everything and be perfect in those areas.
Mhm, mhm.
In those areas. So you can, when you talk about some of these wellness factors, there's people that aren't engaged and there's people that are too engaged, trying
Yes,
to make
absolutely.
perfection the enemy of the good, and balancing that out, personalizing that, working with individuals to support them in their decisions is actually a core aspect of doing whole person care. And that's what the what matters question is all about.
I love that. And your last point really hits home for me. I think I see that in a lot of patients, and being in the fitness and wellness community, there is such a difference between, and I think this comes with some of the emotional health that you mentioned earlier, is the intention behind the practices that we're doing. Are we doing them because we're trying to be perfect, because we think we're not good enough and we're trying to make up for some lack? Or are we doing them out of a true love for ourselves and wanting to take care of ourselves and help ourselves reach our full potential? And just the difference in intention behind those brings with it a different level of stress that activates all of the stress response in your physiology, and then can create a very different experience. So yeah, I love that you brought
Yeah,
that up.
no, there's no blame here. Okay, you can't blame harms. Okay, it
Right.
increases stress in those areas, and so and again, many of the things around these areas, behavior and lifestyle, they are things that increase and shift probabilities, but they're not necessarily the cause for any individual.
Right.
Okay.
Right.
So we don't actually have proof that this caused this in you. In fact, that's a misuse of statistics. It's a misuse of evidence in those areas. So helping people to understand, how you nudge things one way or another, and in fact, it is nudging one way or another, and then finding the thing that they are most passionate about. Okay, that they can do, and just helping support them being successful in that. This is what health coaches do. So I like to bring health coaches into all my care. After I visit with the patient, I have them work with a health coach to help them find the one or two things they can be successful at and help them get to that. And then that empowers the patient in those areas and moves away from any kind of blame.
Mhm. Now, I want to start talking about how we actually bring this to life in the healthcare system. And I love that you started with this survey and said there was a mismatch in terms of what patients wanted and what doctors thought patients wanted, or what they thought was best. And I think so often I see a lot of patients who, quite frankly, are scared to even be fully transparent with their conventional specialist, because they think they're going to be not believed, or the specialist is going to poo poo them for going to do acupuncture, or whatever it is that they're working on. And so there's then this lack of transparency and communication in the relationship that I think can be challenging. And like you also mentioned too, so much of the conventional system has become very transactional, and where patients don't often feel empowered. And there's so much fear, in cancer itself, but also in the healthcare system, where patients just kind of feel like they're on this assembly line and they receive whatever care is given to them, but they don't have a lot of ability to voice their own desires. And so How have you then taken this research and data behind all these other factors that are important for healing in cancer and started to integrate them in a system that wasn't using them to begin with?
Yeah, so I'm very practical. I see patients, and sometimes I also only have 20 minutes to see them in.
Right.
And so I need and when we ran our learning collaborative that where we in the primary care area that we published in the Annals of Family Medicine and others, we had to actually focus on, well, what works, what doesn't work, what brings uptake, what can allow this to be done. And so we decided we needed to do that within the cancer area also, and we shifted over to cancer area. So we put together, Dr. McManaman and I put together a network of leaders around the country and some overseas also, that really looked at the tools in primary care that were working and said, can we begin to build a similar type of thing in cancer care? Okay. So this was a group, I think, of about 15, 16 leaders from different centers, both academic and community centers around the country mostly, that began to look at these tools. We met every month, sometimes twice a month for 2 years, and we began to build these kinds of practical tools and test them out in practice. Okay, so that then resulted in the examples and knowledge that we write about in the book on how it was being done, how these different centers are doing it, and what was useful, what could be brought in those areas. And so on our website, both the book website and the Healing Works website, we've put these tools and support resources for doing that. An example of that is something called the Personal Health Inventory. So this is a simple 2-page questionnaire that the patients fill out before the visit. And immediately after going through it, they know this is going to be a different conversation. This is going to be about how do you improve health, what's important to you, what does the team need to know to better take care of you as a person? That's the second question beyond what matters.
Yeah.
And then they identify what are the areas of health and well-being practices that they need the greatest help on. Okay, so it could be sleep, it could be social support, it could be basic needs, the so-called social determinants of illness. They may not have money to be able to, or transportation. They may not be able to buy food or even the drugs if they don't have a good insurance plan. So we ask about those and identify what are the key things that are going to inhibit their ability to maintain their health and to incorporate health promotion salutogenic components with their cancer plan. That then goes into the dialogue in the visit right up front. We write something called the hope note after that. A lot of your listeners do the SOAP note. Your doctor will do the SOAP notes, subjective objective assessment plan. That's for the disease. The hope note stands for healing oriented practice and environments. That's the dialogue around health and well-being and healing. And then we put that into the plan right up front. Okay. And so the team is aware of that and they begin to implement those components. And so those are very practical things that any practice can do. All those resources are free on our website. We partnered with Tufts University Center for Medical Education to produce CME modules in these areas. And we now have three, they've released 3 of them. One is on chronic pain and whole person care, one is in primary care, and one just out this month, actually in May, depending upon when this podcast is being listened to, is specifically on whole person cancer care with examples from around the country where they see that this is happening. And so you can get all those resources on the website and you can get the CME link. You can go, if you'd like, and you'd like your team to do this, you can get the book, and there is a reader guide or a team discussion guide that goes along with that that's available. And so you can begin to put it into your practice improvement component to make it more routine in your practice. So those are some very practical tools, whether you're a solo practitioner or whether you're a system leader, to begin to implement this in your routine care.
Amazing. So lots of ways to get involved and start to implement this as a practitioner, as a healthcare system. For a patient, let's say you're a patient who's facing cancer and you would really love to work with someone who's using this model. How can you seek out centers or doctors who are aware of this model?
Yeah, that's a great question. And I've seen this in complementary medicine before, and I think it's happening in whole person care too. The biggest driver to get it is to ask for it.
Mm. Yeah.
And to look for a center that is providing it. And if patients will stand up and say, "Hey, I want this kind of care. Do you provide it there? I'm looking around as to where to get my best care. Let's find it." In the surveys we did, we found that there was a 13% jump, I think, for 13, 15% jump in 1 year of patients who said that whether they're getting whole person and integrative care would determine where they went to get their care. Okay.
Yeah,
So I think those systems like that, they're, that's business for them. And
absolutely.
some of them are now using the term whole person as a marketing tool and as an advertising tool. But then you have to see, are they actually delivering it? Do they have the resources there? Are they doing that? The second thing that patients can do to get this is they can look for centers that have integrative resources already. Maybe they have an integrative center, the Susan Samueli Center out in California, for example. Here in Northern Virginia, where I live, the Inova Center has a big cancer supportive program with all of these tools called Life with Cancer in those areas. So they're around. People are using them. They're available. So, look for the centers that have those available and go and do that. The third thing that patients can do is that they can get a copy of the book, read it themselves so they understand what they're looking for, hand it to their oncologist and say, "This kind of care I want, can you provide it? Okay. Can you help me move in this direction? Will you work with me to do that?" Those kinds of demand requirements are some of the biggest things that will occur. And eventually, both the practices and even the policy and payment things will follow.
That's amazing. So lots of different ways to advocate for this type of care. And it requires all of us, right? So for
Yeah.
for it to become standard, we all can do our part to help bring it into practice. I want to talk a little bit about the concept of, or the importance of, hope and belief in medical care, in cancer care specifically. We talked about this a lot in our last conversation, and just how powerful our minds are, how powerful our beliefs are, and the stories we create around what's happening. And as you mentioned, I think out in the world, there is this general association with the word cancer and a lot of fear, or a lot of, like you said, imminent, mortality. And so, and something I've always struggled with in medicine is the idea of prognoses, and giving patients prognoses in a way that's consistent with what they want, and that still instills hope and belief in their ability to defy the odds. So can you touch on that specifically in cancer care?
Yeah, let me mention a little bit about the importance of meaning and purpose in the mind in healthcare in general, and then I'll talk specifically about it in the cancer, because it is a little bit different in that area because of the fear that is generated there. So when I was at the World Health Organization Center, and we were going around the world looking at all kinds of different approaches, I was struck by how diverse they are. It's amazing. The models they had, the practices that they had, et cetera, et cetera. And I realized from previous work that I had done on the placebo response that there was something not only about what they were delivering, but how they were delivering it that was important. And in fact, how they were delivering it oftentimes was the biggest factor for the outcomes.
Mm-hmm.
Now, in Western medicine, we call this the placebo effect, right? The ritual, the belief, the component, the learning component of that. But Dan Moorman from the University of Michigan and I wrote an article a number of years ago saying this is a wrong word. Okay. The placebo response, and what we call placebo, which is tainted with this idea that it's inert, is really about creating rituals and meaning that facilitate and engage a person in their own healing capacity through hope, through belief, through conditioning and other mechanisms. And it doesn't really matter what the treatment is, conventional, unconventional, traditional, et cetera. If you're not delivering it in a way to enhance that meaning effect, okay, you're not getting the biggest bang for your buck in
Mm-hmm.
those areas in the process. And so it's important to learn those skills, the process of creating meaning, hope, and belief in your patients and with your patients, in order to facilitate whatever treatment that you're doing. So that's number one and very important. Now, in cancer care, this can be a little bit tricky. Because you don't want to give somebody's hope that a treatment can be used and it's going to cure them, which they may assume when there's no evidence that it will do that. Okay. In fact, you want to make sure they're not being harmed. And so we created something called the 4P, which is a guide to how to create hope in patients. It applies outside of cancer, but especially in cancer. Number one, prevent them from harming themselves by going out and doing something where the evidence says this is not working or there's no evidence. Number two, enhance the process of delivery using the meaning and purpose components of it, if you will, to allow things if they're not being harmed in those areas. So facilitate that. Number three, if there's good evidence, try to make it available. There's a lot of treatments that people don't get. In precision oncology now, where we're getting these molecular markers, and you may be able to get a personalized treatment for your particular cancer. If the evidence is good for that, try to do something to get that and make that available. Always partner with the patient. That's the 4P. Okay, because we're a complex adaptive systems. Okay, healing emerges out of that partnership and that relationship in those areas. And if you're just doing a checklist in those areas, you're not going to tap into those deeper conversations that taps into their own intuition, which is where hope comes from. Okay, it comes from those deeper intuitions. So make sure you partner with those patients. Now, sometimes you have to have a conversation that is, not all that easy to have. Okay, if there is no treatment, if treatment's not working, et cetera, you need to do that, and that's called a serious illness conversation. People in palliative care do it all the time, but often we don't bring palliative care in until it's way too late, right? And the palliative care guidelines say bring it in right up front. Within 8 weeks, you should be having palliative care about coordination of care in those areas. So you have to sometimes have a dual conversation to create hope and have a conversation about what is the environment and the context in which that hope could occur. How do you want to live your life if you only had this type of life to go? And if these options, were going to perhaps cause more harm than good, what's your decision about that? And what are some of the options that you might want to continue, including palliative care in those areas? So you almost have to split your head and say, I'm going to have a talk about what I'm alive, and I'm going to plan if I'm not alive, and have that serious conversation. There's ways to do it. We're working with Adriana Labs at Boston Medical Center right now, Harvard Medical School, to train people to have those kinds of conversations. And they're not isolated only to cancer. Anytime there's a serious illness, those conversations are very important. And when you do have those conversations, people really appreciate it. Okay, but you got to have them right. And so, look for the serious illness conversation guide and process. And there's a training program there that people can get so that they can learn how to do that.
Right. And really, maybe it's a conversation we should all be having, early before we're diagnosed with any of these things. Right. And then maybe we check in periodically. Maybe it's something we have with our loved ones or in the medical system, but better
we can see chronic disease markers and risks coming down the track. The train is coming down the track. Science actually shows us, and you can track those markers. So why not go upstream and modify those before the disease becomes fully manifest in those areas? Now, there's a bestseller book out, right now, probably called Outlive by Peter Attia. And that's what he talks about. There's another one by Leroy Hood and Dr. Nathan called The Age of Scientific Wellness, which is all about saying, wait a minute, the science has the ability to actually see those things long before they occur, and we can modify many of them, not all of them, but many of them. Let's make medicine about that. And boy, what savings we would have on the background, both in suffering and costs.
Absolutely. I hope and dream that will be our reality here sooner than later. And going back to, I think, your first point about this healing response, I think when I've heard you explain it before, this idea that there's so much about the ritual. For example, in the US, you expect to go to the doctor to get a prescription, to go to the pharmacy to take the prescription, whatever else it might be, your chicken soup or whatever else you do when you're sick. Um, and that there is even if someone were to get a prescription that was a sugar pill, there's still healing that can happen because of the ritual around that and the belief that this is going to make you feel better. Versus maybe in Chinese medicine, you think you're going to go see an acupuncturist and that is going to help you feel better. And even if you get sham acupuncture, there might still be some healing that happens around that ritual. And that really hit home to me that it has to be culturally specific. But I'm curious if you could give us an example of, it doesn't have to be cancer, but even just prescribing a blood pressure medicine to a patient. How do you maximize that healing response when you're communicating with your patients?
Yeah, so I think the core ways of optimizing the meaning response are number one, determining what the patient believes in. Okay, what do they think is going to be effective? Number two, determining what you believe in. Okay, make sure that you think, yeah, there's good evidence here, this will work, et cetera, et cetera. Aligning those. And then setting up a ritual to actually deliver it. We used to think that in order to test the placebo effect or the ritual meaning and ritual or context effect, you had to blind the patient. They couldn't know because if they believed in it, then that would make it more effective. We now know that most of those factors that the mind produces are unconscious. They have nothing to do with what you're thinking in the front part of your head here. Okay. There's been now great studies showing that even open placebo studies, where you're told it's an inert substance, but if you go through the ritual process, if you engage in the treatment and the relationship, you'll get better. Guess what? That works just as well. Okay. You
Amazing.
don't actually have to blind it. There's not an ethical issue about hiding anything here. It's about optimizing actually that relationship. There's a great book, and you might want to interview him here on one of your podcasts by Steve Bierman. Okay, it's called Healing Beyond Pills, I believe it's called, and it's about the noetic processes.
Yes.
What he does is he brings in not only some of the meaning and placebo literature, but he actually brings in some of the literature, extensive literature we now have about hypnosis, for example, and the use of suggestion and mind-body power dynamics that occur naturally within a physician-patient relationship. Uh, to the advantage to healing. He was an ER physician for many, many years, and he developed techniques, for example, that could do painless injections,
Wow.
prevent bleeding prior to surgery, et cetera, just through these communications and preparation components. We systematized something like that in a study that we supported years ago, where in cancer patients that were undergoing breast cancer surgery. And we it was a randomized control trial where we gave half the patients a set of imagery components to listen to, and then some instructions about what to affect and how to prepare themselves through relaxation and imagery, and a couple other things, bands for the nausea-based acupuncture, in those areas. But they did acupressure in those areas prior to surgery, and we gave people a little kit that they did prior to surgery, or they didn't. They just got the usual care. And we found that not only did their pain and the drug use go down for those who got the kit, but they recovered faster, and their inflammatory markers post-operatively were reduced. So the physical, biological effects were actually better for their long-term healing in those areas. A simple mental noetic technique that involves education, involves imagery, involves tapping in to the intimate link between the mind and the body that exists all the time.
That is amazing how powerful our minds are. Well, I wanted to touch a little bit on zooming out to your Healing Works Foundation, because this is new since we last talked. And I'd love to hear just a little bit more about your overall personal mission in medicine and healthcare. As we hinted at a little bit, what we'd love to see happen in healthcare being so proactive and preventive and saving people out of suffering and disease. But what is Healing Works Foundation focused on there?
So the Healing Works Foundation is something that we set up a little over a year ago in 20 the beginning of 2023. So it's new. It's a new foundation. It was generously funded by the Samueli Foundation that I used to work for, Henry and Susan Samueli, who does a lot of work in integrative practices and those areas. But the mission of the Healing Works Foundation is a little different. We're interested specifically in whole person care, and our goal is to make it routine and regular, make it a standard part of care, not something you have to go over to a special center to get. And so we do that in several ways. One is through education, like this podcast and training, and the CME programs that I mentioned to you that Tufts has put together so that you can learn how to do it. Second is to provide tools and processes so that teams can implement it into routine practice. And the learning collaboratives and leadership groups that we talked about are ways to test that out. And now those tools, many of those tools are available in both general medicine and in cancer now with this new initiative. The book is an example. The two books are an example of that. And then we work on the thought leadership and policy level, okay? Because we have to be able to pay for this and cover this in those areas. And if the resources are being built, the demand is there, the evidence is there, then following the 4P principles, it's in the proven area. The question is, all right, now let's partner together to make it happen. And so we work a lot on the policy level to see if we can get payment models using value-based or bundled-based approaches that allow the flexibility for whole person care. And a number of centers, especially in underserved populations, we've been working to facilitate testing those out to see if new models of care that are whole person can actually reduce costs and simultaneously improve health and reduce risks in those areas. So that's what the Healing Works Foundation does in those kind of three levels in cancer and in primary care.
It's amazing to see you taking such a strategic approach to addressing it at all of these levels that are so important for making it standard. I'm curious, through your work, through developing whole person care, through advocating, through practicing whole person care yourself, have there been moments or experiences to you that have been most rewarding so far?
Well, the thing that is the most rewarding in this practice is when I am working with a patient and we're talking about, what's important to them and what do they need right now. And suddenly they just say, the most important thing to me is X. Okay. And I've always wanted to do this. I'll give you an example. I had a man in chronic pain, over a decade of chronic pain. He'd been on opioids. He was on lots of medications. He had had a couple surgeries, been to pain specialists and rehab and this type of thing. He had chronic back pain, unfortunately, a very, very common problem. And I sat down with him and said, hey, you've been through all of these. And what is it that you really want and really need? And I knew he wanted to get free of his pain. We had that conversation already, and many had. And he said, what gives me the biggest joy in life that I can't do because of this is that I now have 3 grandchildren, and I can't get in my car, drive a few hours down there, and get on the floor and play with them. And that's what they want. Okay.
Mm-hmm.
And I just love that. It's just, I want to do that. And I said, okay, well, are you willing to go through what's needed in order to do that? Anything, doc, anything. So I took him and marched him upstairs to the physical therapy department.
Uh-huh.
And I said to the physical therapist, same one that he'd seen before, I said, you need to work on the function so this guy can get up and down off the floor.
Mm-hmm.
And I turned to him and I said, this is going to hurt. You can take some, non-steroidals before you go into the physical therapy, or better yet, let's go and get acupuncture, okay?
Sure, yeah.
And combine acupuncture along with this pretty, focused and difficult physical therapy you say you're willing to go through, and let's get that set up as a plan, okay? Very simple thing. wasn't talking to him about diet, wasn't talking about going out and run a marathon, wasn't doing any of that kind of thing. And guess what? He said, all right, I will do that, because he's motivated, right? It anchored in what mattered to him. And he went up there and he went through a lot. He took his ibuprofen, he got his acupuncture, he went up, and the physical therapist really worked on his core muscles. In about 3 months, he came back to see me and he says, guess what? I just drove down, got down on the floor, played with my grandkids.
Oh, yeah.
That made more to me than, hey, this procedure, that drug, etc. Because now he knew he could actually engage in his own healing, and he actually, did it in a way that was meaningful for him. That's whole person care.
That's beautiful. That's beautiful. And I'm sure there were a lot of other things in life that got better too, that he could do that he couldn't do before, because he had that focus of a specific goal, of something that was motivating to him and that was worth going through some pain and some discomfort.
Yeah, now as a side effect, he could actually move around more and go out and walk, and because of that, he actually slept better.
Yeah, right. All kinds of good things happening.
Surprise. All right.
That's amazing. That's amazing. Well, last thing I want to touch on before we wrap up is a organization that we are both a part of, that I believe you actually got me involved in, Primary Care for All Americans. And this is a very grassroots movement with a goal of bringing primary care to every person in America. And doing, a lot of what we talked about today, which is putting people first, putting people over any profits, and doing what's right for people. And so I would love to just talk about what drew you to this group to begin with, and then what do you hope that we accomplish through this movement?
Well, thank you for asking that. This is a fantastic group. Anybody listening to your podcast should join, because there's a role for everybody. They don't have to be healthcare professionals to do this. And thank you for joining the board and the leadership there. It's important. The purpose of, we know, for example, that primary care, especially advanced primary care, it reduces costs, it improves health. It's the solution that we need for the problems that are ailing healthcare. And so if we really want to fix healthcare, if you will, we've got to make primary care all for everyone. The evidence is there and it's very clear. However, there are forces that don't want us to do this. Okay. And the reason is because they're making a lot of money off of it, and they got trained in it, and there's patents and approvals for the things that you need. And if suddenly you didn't need that anymore because you were doing more primary care, then those resources are going to diminish, which is exactly what's needed because people are getting healthier. Now, those forces are not going to go away easily. Okay, they're not going to readapt and readjust themselves easily unless there's a movement. And what got me into this was the two leaders, Dr. Fine, who used to be the health commissioner for Rhode Island, one of the more advanced states in this area, and Alan Roth, who works in a safety net hospital with huge needs. And he said, we're going to do it in our hospital, and we're going to create advanced whole person primary care for all, for the 138 languages that we deal with
Amazing. Yeah.
in Queens, in those areas. And guess what? They're doing it. They're actually doing it. So there's no excuse for anybody else. All right. What we really need is a movement. And as Michael Fine, Dr. Fine says over and over again, the only thing that it really revolutionizes things and transforms them is when the public demands it. And so primary care for all is an effort to make primary care, advanced primary care, available in every community, and then facilitate each community building it for themselves in those areas. And so that's what the goal is. And if we do that, we may be able to actually turn the tide on the direction that we're going in healthcare now, increase the equity, increase the access, increase the health, and reduce the costs of care in our nation. So I encourage everybody to join this, everybody to move forward with that and be part of the movement.
Yes, absolutely. Please check it out. I'll link to the website in the show notes. And there are talks, and which Dr. Jonas or Wayne gave one a few weeks ago that was excellent, and opportunities to talk with people in small groups and get connected to your local communities, other people who are passionate about bringing primary care to everyone. So highly
That's right.
encourage
No, that's
everybody.
right. There's these leadership talks that are occurring, but now they're building support networks, technical networks. So if you say, "Hey, I want to have primary care in my community for everybody," there's people there that can actually help make that happen in your community. So again, join it and join one of the groups and make it happen in your community.
Absolutely. Well, I want to wrap up with three questions I ask everyone at the end of the podcast. So I know you answered these a few years ago, but things always change and evolve. The first question is, what are the three things that you do on a regular basis that have the biggest positive impact on your health?
Well, I forget how many years it was that we had this previous conversation, but I know when I was younger, I would have said exercise. That's really important. Okay. And I know you're really into exercise. So keep doing it. Very important as you get older. It's still very important, but that's not number one. Number one is my family and friends. Number one is the social support and the social network that I'm embedded in. This is by far the most important thing for improving the quality of my health. And the data actually shows the longest health study ever done out of New England showed that the number one factor beyond anything else, including smoking, by the way, don't
Mhm.
smoke, was social support to keep people healthy and functioning in those areas. And now, as I get older, I realize that actually, and I can't exercise quite as much and as well as I used to, but still can. So that's number one. Uh, I still exercise. It's still very important. I still try to eat a vegetable-based anti-inflammatory diet. But I'd say number two, which I struggled for a long time, and I know one of your questions is what have you struggled with? I think that's
Uh-huh.
one of your second question. Ones that I struggled, that should have been the easiest thing to do. But still, for me, it was one of the most difficult things to do. And that is learn how to quiet my mind,
Mm-hmm.
meditate,
Mm-hmm.
to actually not get hooked into my thoughts and feelings and then suddenly running off, as they say, the monkey mind, dragging me
Yeah.
off, worrying about that is not something that's not here and now. Okay.
Mm-hmm.
But occurred in the past or may never occur in the future, but I'm still worried about it in those areas. I learned to meditate when I was in college, but I had a hard time doing you know somehow it didn't feel productive, and over the last 2 years since we talked, I've begun to embed 15 minutes of mindfulness meditation using an easy app, and there's a lot of them around, and really doing that seriously every single day. And now what I'm finding is that's penetrating the entire rest of my life.
Mm-hmm.
When I sit down with patients, I can take a breath, I can get into that spot, and I can hear them better. Okay. I can connect with them better. Things that used to bother me that would come up in the family, for example, or things that happened politically, and I can now actually see this the peace begin to penetrate into that area. And that really has improved the quality of my life. Not only the peace of it, mitigating the fear, but the joy that spontaneously emerges out of that makes me think that life actually is benign in some way because you can begin to see it. There's no better word than saying love somehow permeates it. And all we need to do is clear the cobwebs away, and then we can see it happen and actually experience and feel it happen. And then the third one is keep active. Get up and do stuff, do something that's meaningful for you, give back. I discovered that towards the end of his life, Maslow, who wrote the hierarchy of needs and
Yes.
had self-actualization at the top, towards the end of his life, he changed his whole pyramid and he added self-transcendence at the top. And that meant not self-actualizing, but actualizing the community benefit beyond the self in the community. And that brings us full circle back to the social components that I now know are the most important thing.
That's amazing. I can relate to so much of what you just said because I think mine have evolved a lot over the last few years as well. And where I used to think that nutrition and exercise and sleep were the end all be all, I now realize that underneath all that it's the higher sense of meaning and purpose and being able to connect with that. It's the relationships. It's the ability to be mindful and aware of emotions and thoughts and not allowing them to unconsciously control you throughout the day. And so I love that. I've also become a much more routine meditator over the last few years. Before it was, I would pick up a nap here or there. It would last a few weeks and then I'd let go of it. And now it's become, I think for me, the biggest change was once it became a consistent practice for days and weeks and months, then you really start to notice, as you said, the way that it permeates every minute of the day, not just when you're meditating.
That's right. Well, you learned it a lot sooner than I did. So congratulations. The way I talk to my patients about this, I say, this isn't about stress management. This is about mental fitness. Okay. You understand physical fitness. You have to train and work on
Yeah,
it if you want to stay strong, in case you need to go pick something up. Right. And this is a mental, this exercise, mindfulness and meditation is mental fitness. And the studies have shown that it actually works that way. If you can get into sort of a deep relaxation component for even 20 minutes a day, your brain begins to change, and that part of your brain that allows that to happen grows just like a muscle. We have neuroplasticity in that. And that's why, as you've been doing it, as you just mentioned yourself, you're finding that it begins to permeate more easily into the rest of your life, is because you now have that muscle. And guess what? It's there, and it's easier to pick up the piece, anytime you need it.
that's right.
So
That's
yeah, so
right.
congratulations on doing that. Took me a long time to figure
You
that
too.
out.
You too. And it builds resilience. Like you said, it's like training, physical training builds your resilience so you can go out and do the things you want to do and not be limited. But same with the mental aspect, it allows me to be so much more mentally and emotionally resilient. I can handle a lot more coming at me without feeling stressed, without feeling anxious, without, um, you know, without getting overwhelmed where I might have been in that state before. So,
And I would say that people with cancer, this is especially important for them because they are barraged by existential threats all the time. I learned this from my co-author Elizabeth McManaman, who I say is the heart of the book, uh,
yeah.
and really says that it's out of that heart that deep connection to yourself, first of all, out of which all other healing emerges. So yeah, that's the most difficult, but it is the most rewarding, I think, in the long run, and in the expense or the expanse in which it permeates the rest of our lives.
I agree. Well, what is one thing you're working on now, or one thing you think would have an impact, but you have a hard time implementing it at this point?
I don't know. I've decided I'm going to pause for a bit and not jump at another thing yet. And
That's a good practice.
over the
Yeah.
next several months, just see what emerges. Okay, in those areas, I think it'll be somewhere along the lines of what we've just talked about. But I'm not exactly sure what it'll look like. So I'm waiting.
All right.
Waiting. I'll continue to pause to listen. So a couple of years we can come back and I'll tell you what it is. I have no idea at this point.
That's great. I love that. All right. Last question is, what does a healthy life look like to you?
Well, I think we just described it, actually. It's a life, first of all, that's anchored in peace and is not controlled by fear. It's a life in which joy comes out every moment or every day, at least, and you see reasons for gratitude and hope. That it's about love and the relationships that you're in, and the experience of intimacy and connection that you have with others. And it's about activity. It's about getting up and moving, getting out of bed. I interviewed myself, the woman called the mother of holistic medicine, Gladys McGarry, who is 103 and just wrote another book.
Wow.
You might want to talk to
She's
her.
living it. Yeah. That would be
And
amazing.
she says, I get up every day and I look for what I need to do to be better and to help others be better. And that drives my life. So that's
Wow.
wisdom embodied.
That's beautiful. Well, thank you so much for this time, Wayne, and for all of your wisdom. I'm glad to be sharing this with my audience and hope that more people are exposed to whole person care, and then together we can help make it the standard of care everywhere.
Well, thank you, Julie, for what you do also, and it's been a great conversation. I've enjoyed it.
Thanks
so much for tuning in. If you enjoy listening to the podcast, please consider subscribing and giving it a 5-star rating on iTunes. It really does help to get the word out to more people.